Good afternoon. My name is Brian Wilson. I'm with Commonwealth Home Health Care. I'm a respiratory therapist. This is Tennille McDowell. She's a respiratory therapist with our company, and Erica Thompson. She's the operations manager with our company. We'd like this afternoon to talk a little bit about one particular piece of equipment that some people are having some issues with in the field, just because a lot of times they're unfamiliar with the piece of equipment. And what I'm talking about today is a 50 PSI compressor. 50 PSI compressor looks sophisticated, but actually it is nothing more than a real big air compressor. Oxygen can be induced to a patient that's using a 50 PSI. We'll talk about that in just a little bit. But for the most part, it's only air, and it's used to humidify air going to a patient. So it's really not that sophisticated. The equipment itself, it has a power cord. Some of the problems that we experience in the field when we talk about power cords, this particular model, you have to plug the power cord into the back of the machine and then into the wall itself. Thanks, Tennille. In the back of the machine, it looks just like this. It plugs in. So one of the problems that we may see with a 50 PSI compressor is they'll call and say it's not working. And it's simply because the plug has come loose from the back of the machine or from the wall itself. So one of the first things we always look at would be that power cord. The second part about a 50 PSI compressor, on the back of the machine again, there is a filter. The filter just simply pulls out, and that filter is a large particle filter that catches large pieces of dirt or dust that may get into the machine. It's basically so the motor in the machine stays nice and cool. Really doesn't affect the air going to the patient themselves. This just keeps the motor cool on the machine. On the front of the 50 PSI compressor, there is an on-off switch. When I turn it on, the motor starts to run, air comes from the outlet. On the front, there's a dial that adjusts pressure. That is, adjust how much air actually comes out of the 50 PSI compressor. So we could make that air flow higher or lower by turning this dial. What we use again with the 50 PSI compressor in the field is what we call a large volume nebulizer. It's just like other humidifier bottles. The idea of this nebulizer is to take water, baffle it into a fine mist so that it'll go through some tubing to a patient, helps the patient thin secretions, keeps their airway moist and comfortable. That is the number one reason why we use 50 PSI compressors in a home care environment, is to help humidify a patient's airway. So with a large volume nebulizer, they twist apart. The nebulizer comes apart like this. We would put sterile water or distilled water inside the nebulizer. There has a line on the nebulizer. It's very hard to see probably on the camera, but there is a line, a different shade, so you know to fill the water up to that point and not go above. Don't want it too high. It needs to be down about midway in the container. The top fits on and twists. Now, the problem with large volume nebulizers sometimes is that they cross-thread plastic and plastic. So you can imagine if you don't get it square, if it's tilted just the least bit and you twist it, it will stick, but yet it's cross-threaded so it leaks. It's not a closed system. So when I attached that to the compressor and tried to give a mist to the patient, my airflow would leak from around the top. I wouldn't get enough pressure in my tubing to baffle and create a mist. So sometimes folks would call us and they'll say, it's not creating a mist, and it's because they didn't get this piece put back together straight. So you always want to be sure it's flush, nice and flat, and you have to twist it a good 3 or 4 times to get it just finger tight. On the top of these large volume nebulizer, and another point to make here is there are a lot of different nebulizers. They come in different sizes, shapes, and colors. All of them do the same. You have water inside, the baffle system that creates that mist that comes to the patient itself. On the top, you've got an orifice that controls room air, the entrainment of room air, so that if this was hooked to an oxygen source, flow meter inside a hospital typically is where you would see it. This is hooked to an oxygen source in the hospital directly to a tank or to a wall outlet, then I could adjust the amount of oxygen the patient would receive here with this orifice. And it tells you, for an example here, it shows 5 liters would give me 28% for a patient. So I would set the arrow to the 5 at 28 and make sure when this was hooked to a wall outlet that my flow was turned to 5 liters, and it would work fine. It would be effective. In the home care environment, though, we're hooking this to an air compressor, not an oxygen outlet. So essentially, this device on the top serves no purpose because only air is coming into the large volume nebulizer. The nebulizer twists to the nipple on the top of the 50 PSI compressor onto the outlet. Again, plastic on metal when we twist it. So you want to be very careful not to cross thread. If you cross thread this device, the exact same problem that I talked about here is going to occur here. If I tilt this, it's at an angle, it cross thread. When I turn the machine on, the air is going to leak from the top, not go down into the nebulizer, therefore it won't work correctly. So we want to make sure there's no cross threading. It's nice, only finger tight, in place. Of course, it's filled with my distilled water. The next step is corrugated tubing. And the corrugated tubing, these are 2 pieces. Typically, we don't like for the corrugated tubing to be longer than 6 feet. We've got in the center of the corrugated tubing a drainage bag. And this drainage bag, you can imagine, I told you the purpose of this is to humidify. So when I hook my corrugated tubing, either end, doesn't matter, to the bottle, and now it's ready to go out to the patient, that's going to fill with a fine mist. And what happens with that mist is you'll get drainage. You'll get excessive water in the tubing. So on the bottom, you can see at the lowest point, we have a drainage bag that catches excess water so that it doesn't, 1, block the line, or number 2, fall to the patient and actually get into the patient's airway or on their clothing and create a problem for the patient. So we cut this tubing, and most of the time it comes in one long roll. You cut it so that bag hangs at the lowest point and fills with water. The typical device to transfer the mist to the patient is a trach mask. The trach mask has the 15 millimeter end that fits right into the corrugated tubing, and then the mask, of course, fits onto the patient themselves, and the mist is delivered. It's a very simple process. If this patient needed to have oxygen with the mist that we deliver to the patient, then we use what we call an entrainment valve. It's just a T-piece with a nipple on it that we can hook to the corrugated tubing and to the mask itself, and we can give the patient a specific concentration of oxygen. The supply tubing hooks to the delivery device, which could be an oxygen concentrator, or it could be a tank of some type, an H tank, an M tank, some type of oxygen delivery device. We hook that to the nipple, set the liter flow based on a doctor's order, and now we've got oxygen that's being entrained in with the mist delivered to the patient. Common problems that sometimes take place with the device, I talked about one. The most popular is the cross-threading of the large volume nebulizer and the cross-threading of where we attach the compressor and the bottle together. We just get in a hurry, just don't hold it flush, a little bit of an angle, that creates a problem. Another problem sometimes we see is the drainage bag is not put in the right place, and so we get a lot of condensation in the tube, and that sometimes can obstruct that mist going to the patient themselves. The thing to remember about the large volume nebulizer, as well as all the tubing, anything that the moisture is in contact with needs to be changed frequently. By our company's policy, we replace these every week, and we encourage the patient to wash and clean them every day so that they stay. Remember, we've got water. The chance of bacterial growth is higher. It's easier for the patient to get sick or catch some type of an infection. So we want to make sure we keep it clean and change it frequently. The example I use with patients is you wouldn't take a glass of water at home, fill it up, set it on the counter, and once a day take a drink from it and leave it sitting on the counter. And every day you come by, take a drink from it. You wouldn't do that. No one would. Same example. This needs to be dumped every day, cleaned, refilled with fresh water, so it's nice and comfortable for the patient. The way we adjust the mist going to the patient would be, one, by turning this knob on the front again. We adjust the knob, either increase the pressure or decrease the pressure, and that is going to increase the mist or decrease the mist. It's very simple. Some people will turn the entrainment valve here at the top. That will affect the flow of mist going to the patient. Won't hurt anything, and sometimes it's an easier adjustment. But either of these will adjust the mist that's flowing to the patient. And remember, we don't want an overbearing mist to the patient. You should have to hold the end of this tubing up and look closely to see the mist coming out of the end of it. If it's overbearing, when the patient puts it on, they're going to be soaking wet. Their gown, their hospital gown, or their shirt at home is going to be very wet. It's going to be very uncomfortable. So the patient is going to be inclined not to use the device. So we want to make sure that we set the mist for a comfortable level going to the patient so that it thins their secretions. They can mobilize and move that sputum. And then also it's comfortable for the patient. Keeps the airway nice and moist and wet. Anything I leave out?
Is there any certain place where this dial should be on the gauge when you first set it up?
No, typically you can make the adjustment based on, and I would recommend they probably sit in one place most of the time. When you turn the machine on, you look to see what mist you're getting and then make that adjustment. Okay. And sometimes, maybe a different type of bottle. That large volume nebulizer, sometimes they make tall skinny ones, and it requires a little bit more flow to get a mist, where the short fat ones tend to not require quite as much flow. But they work, like I say, the adjustment's very simple. It's easy to do.
Okay. And the entrainment valve at the top, it has holes in it that can be covered. And when you first start out, should those holes be covered? Or
it's a good idea to have the holes covered. Have it all the way closed is a lot of times what we'll say, so that there's no room air that can mix. So it's all air from the compressor. And we make our adjustments, see where we are with the mist, then we begin to make our adjustments to make the patient comfortable.
Okay.
Anything else?
The filter on the back of the machine, how often should that be checked?
At least once a week.
And can that be cleaned?
Yes. Good idea. Thanks, Erica. When you take that filter off, I told you it was a large particle filter. You can simply soap and water, put it under the sink, get it wet and damp, and then you can roll your fingers across it, and dust will come up off of the filter. Very simple. When you get ready to put it back in, you don't want to put it back in dripping wet. To put a paper towel in your hand, lay this in the paper towel and just kind of squeeze it. When you let go, most of the water is going to be gone from the filter. And we take the filter and put it back in the back of the machine itself. But it's an easy filter. Again, that filter, a lot of people think that affects the airflow to the patient. It does, in the sense that it keeps the motor cool so the compressor operates efficiently. But it does not filter the air going directly to the patient. Anything else? Okay, that's a 50 PSI compressor. Again, very informal. We just want to go through how it operates, what the different pieces are. Of course, if you watch this video and you're still not comfortable, we encourage you to call us at 1-800-289-3898. We'll be glad to answer your questions or have a technician come out if we need to. But we find in servicing our patients or our clients this way, is much easier, gives you something to go back to and look at. The biggest problem with 50 PSI compressors is they're not used frequently. So people get nervous sometimes when they have to go back and adjust them or do anything because they haven't done it in 6 months. So you can refer back to this video, make you feel comfortable about what you're doing. Of course, we're always available if you want to call us. Thank you.